News 2 at 4.
Aren't out of the woods just yet, everybody. COVID-19 cases are rising and sharply in several states neighboring Tennessee. So what can we expect here? Health leaders are on alert. Welcome back into News 2 at 4. I'm Erica Francis.
I'm Eric Egan. A lot to get into. In fact, just this morning, Mississippi's Department of Health now reporting over 3,200 cases from the weekend. And that's causing some people to question if restrictions should return here to Tennessee.
State Capitol Newsroom reporter Gerald Harris is live for us in downtown Nashville with the impact the Delta variant could have on our communities. Gerald.
Yeah, COVID-19 rates continue to rise. Alabama, Mississippi, Arkansas seeing sharp increases in their COVID-19 cases just over the past few days. Some people say more needs to be done here in Tennessee to respond to a possible surge. Other people say it's time for people to take on their own personal responsibility.
An increase in COVID-19 cases in Tennessee is causing concern from some.
I think that a lot of people think that this is over, and it's not.
And others who say while we're making progress, we're not at the point to let our guard down.
We're making some progress, but I really do believe that social distances and people continuing to wear their masks will help the situation and getting regular vaccinations.
Tennessee has caused some controversy, firing its top vaccination doctor and ending all outreach to children about vaccinations. Currently, only 38% of Tennesseans are fully vaccinated.
If we don't get more people vaccinated, it's going to be worse than it was last year because we're going to have the variants going on.
But a push to restart health measures that shut down parts of the economy is not welcomed by some.
I think that it's time to let people live, make their own decisions. If they feel the need to wear masks, wear them. It's America. If they feel the need to stay home, stay home.
Adding at this point, taking steps back will do more harm than good.
I was so blessed and fortunate to even have a senior year and get to graduate like everyone else has in the past. So I just am happy that we were able to accomplish that. And so kind of just getting back to that normality is very good and progressive for us, but we don't need to make regressive steps.
So far, out of the 2.6 million or so Tennesseans that are fully vaccinated, the Tennessee Department of Health is reporting nearly 1,000 breakthrough infections with 24 deaths.
Now, it's important to understand no vaccine is 100% effective. The goals for the vaccines has been to prevent severe illness or hospitalizations. And out of the thousands of Tennesseans that have received these doses of vaccines, only 164 people have required hospitalizations. Reporting in downtown Nashville, Gerald Harris, News 2.